Hello all, welcome to pathologymcq.com. We're going to discuss a few palisading granulomas of the skin and their respective causes and how to differentiate them in histology. There are a few inflammatory or infectious conditions which may result in palisading granulomas in the skin or even the subcutis. So these conditions present with something which is known as a palisading or a necrobiotic or a collagenolytic granulomas which may affect the skin and the subcutis. So these type of granulomas typically present with a histologic pattern where macrophages and giant cells are lined in a palisading pattern with central area which is usually composed of degenerated collagenous material. So this collagenous material may appear pink or blue due to the respective material depositions in these areas. For example, there might be fibrinoid necrosis associated. There might be presence of tumor cell necrosis as well in conditions such as epithelioid sarcoma, which is a malignant condition, and mucin deposition in a few conditions. Due to the deposition of substances, we have these granulomas may be red in color when you see at a lower power, or it can be bluish in appearance when you look at a lower power. However, you have to be aware that this is not always a rule and there are always exceptions to this rule. Whenever you see a red granuloma or a reddish appearing palisading necrobiotic granuloma in a lower power, these are a few causes which you can think of. Necrobiosis lipoidica, rheumatoid nodule, and eosinophilic granulomatosis with polyangiitis, which was also previously known as Churg-Strauss disease. When you see a bluish colored granuloma, these are a few conditions which you can think of. For example, granuloma annulare and granulomatosis with polyangiitis, which was previously also known as beginner's granulomatosis. What are the reasons you can see a red colored palisading necrobiotic granuloma? Due to hyalinized collagen. You can see this hyalinized collagen, degenerated and hyalinized collagen, which is surrounded by inflammatory infiltrate, which is mostly composed of macrophages and a few lymphocytes, and then again degenerative collagen admixed in an adipose tissue. So you can see fat areas also in between. So there is a layered appearance when you note here. You can see that there is degenerative collagenous material which is lightly stained and the cellularity is quite low in these areas, followed by an inflammatory area. And again, you see a lightly stained area which gives a sandwich-like or a cake-like appearance. So this is what you can see in necrobiosis lipoidica, and the areas palisading necrotic areas, the decollagenized degenerative areas are typically reddish in appearance. In rheumatoid nodule, what you can see is classic palisading epithelioid granulomas with central fibrinoid necrosis. So this gives rise to a reddish appearance. However, this is not a hard and fast rule. As I already mentioned, these can serve as clues, but depending on the clinical condition, depending on the severity of the patient, these findings definitely do change. And here is an example of eosinophilic granulomatosis with polyangiitis, previously known as Churg-Strauss syndrome. These also give a reddish appearance due to the presence of degranulated eosinophils. Now, we'll come to see a few blue granulomas. So due to mucin deposition, you can see very clearly here that these are all collagen bundles, and in between collagen bundles, what you see are these bluish mucin. And this is something which is characteristic of granuloma annulare. However, again, as I said, this is not a hard and fast rule. When you see something like this, you can think of granuloma annulare. And when you see a skin granuloma with numerous neutrophils, neutrophilic abscesses, and the palisading granulomas, histiocytes, this could be a case of granulomatosis with polyangiitis. However, in these cases, clinical history is very important because, as we know, beginner's granulomatosis or granulomatosis with polyangiitis typically involves the lungs as well as kidney. So you will see systemic symptoms as well. You can see a skin biopsy over here, and you can see that there is definitely a palisading necrobiotic granuloma, which can be identified here. Right? There is a granulomatous area over here, and what do you see in the center? This is something which is bluish in appearance, and surrounding cells are all histiocytes. Correct? So this bluish area, you can see how clearly you can see the appreciate collagen bundles intermingled with bluish mucin. So this is a granuloma annulare. This is a case of a granuloma annulare. Okay, you can see another one over here, another similar palisading area where you can see surrounding histiocytes. These are all surrounding histiocytes. And in the center, you can see that there is mucin deposition in between these degenerated collagen bundles. So this is a case of granuloma annulare. What you can see here, this is another case. You can see there is a similar palisading granuloma over here, but this is typically reddish in appearance when compared to the bluish appearance which we saw in the previous case. Okay, and you can see that this is definitely not tumor cell necrosis, because you have to be wary of a very malignant condition which also has similar palisading necrosis, palisading areas, and a central tumor cell necrosis, which is epithelioid sarcoma. But we do not see any tumor cell necrosis here. However, this is what is fibrin deposition. Okay, and this is the case of a rheumatoid nodule. You can very clearly see that there is a palisading necrotic area over here, and there is central fibrinoid necrosis. And these granulomas are typically reddish when you see it at lower power. Definitely, in severe cases, the findings might change in histopathology, but this is a very classic case. What you can see in this slide is you can see that there is degenerated collagenous areas. You can see lots of low cellular areas where the cellularity is not so much. When we just go to other areas, surrounding areas, you can see over here that the cellularity is high, and these are composed of lots of inflammatory cells. Okay, like histiocytes. You can see a few histiocytes over here. You can see lots of lymphocytes, and these are epithelioid histiocytes as well, which we can see here. Some of these epithelioid histiocytes, right? So this is an inflammatory area, and then you can see another region where there is degeneration of collagen. So you can see patchy areas of degeneration followed by cellular areas, again followed by patchy areas of degeneration. So this gives you a sandwich or a wedding cake appearance. So this is a case of necrobiosis lipoidica.